low birth weight. Now, low birth weight, it is the single most important determination of chances of survival, growth, and development of an infant. So, low birth weight is very important. Birth weight should ideally be measured within first hour of birth. पहला घंटा में बच्चा जैसे जन्म लिया 1 घंटे के अंदर उसको वेट हम लोग देखेंगे. एवरेज बर्थ वेट इन इंडिया इज 2.5 kg. Average birth weight 2.7 to 2.9, so 2.8 kg. Most common cause of low birth weight is in India is maternal malnutrition. Very important. Maternal malnutrition is the most common causes of low birth weight. Maternal nutrition has linear relation with birth weight. So this is very important. Maternal nutrition, malnutrition. Now, how defined the low birth weight? So low birth weight, any neonate weighing less than 2,500, 2.5 kg at birth, irrespective of gestational age. It is the WHO classification. So low birth weight, 2.5 kg, less than 2.5 kg, irrespective of gestational age. Second is very low birth weight. Any neonate weighing less than 1.5 kg at birth, irrespective of gestational age. So there is gestational age, ignore gestational age. So 2.5 low birth weight, 1.5 very low, and extremely low birth weight less than 1 kg. So 3 terms: extremely low, very low, and low birth. Appropriate for gestational age, neonate with birth weight between 10th or 90th percentile. So someone small for gestational age, I'm coming to that point, small for death, or IUGR, intrauterine growth retardation. Neonate with birth weight less than 10 percentile. Less than 10th percentile is IUGR. Now, large for gestational age, neonate with birth weight more than 90 percentile. It is large for gestational age. So what is term neonate? Term neonate means neonate born between 37 and less than 42 weeks, irrespective of birth weight. So this is term neonate. And preterm before 37 weeks, postterm after 22 weeks. So these are the terminology of this. Now, what are the causes of IUGR, intrauterine growth retardation? Coming to that point, so most common in India, maternal malnutrition. Most important cause. Second is some using drugs or substance like smoking, tobacco, alcohol, or drug propranolol that may cause IUGR. Third is maternal factors like short stature mother, primary or grand malfibra, young mother less than 20 years, low pre-pregnant weight. Now, maternal illness like anemia, CRF, heart disease, malaria, preeclampsia, all these causes IUGR. Now, what are the placental factors? Abrasio placenta, extensive infarct, single umbilical artery. Fetal factor, first-born baby, genetic chromosomal aberration, twin or multiple pregnancy, or intrauterine infection. So these are the all causes of IUGR. Now, what is the difference between IUGR symmetrical and asymmetrical? This is also important. Now, how we differentiate symmetrical IUGR and asymmetrical IUGR? Now, in symmetrical IUGR, reduced growth is symmetrical. Reduced growth is symmetrical. That means weight and height are equally decreased. Symmetrical. Weight will decrease hoga and this height will decrease hoga. So this is symmetrical. Now, head circumference, length, and weight are equally affected in IUGR. But in asymmetrical, weight is less than length. So length relation, weight is less than length. So reduced growth is asymmetrical with relative sparing of head. Head उसमें नहीं होता है, head ठीक रहेगा asymmetrical में. Now there is a index, ponderal index. This is important also. Ponderal index is used as an indicator of fetal growth status, especially to assess asymmetrical IUGR. So ponderal index or also is known as Ronus index. It is also known as Ronus index. So it is for asymmetrical IUGR. Now what is this ponderal index? So it is nothing but weight in gram into 100 divided by length and cubic centimeter. For example, a baby weighing 2000 gram and height 50 centimeter So Ponderex index will be 1.6. So a Ponderex index below the 10th percentile may be used to identify IUGR infant correctly. So this is for asymmetrical growth, ponderal index. Now, what are the problems of small for dead baby, IUGR? Suppose baby born IUGR. So what are the problems? So there may be birth asphyxia, there may be meconium aspiration syndrome, there may be hypoglycemia, infection, everything may occur in this case. So this is IUGR, two types, symmetrical, asymmetrical ponderal index, or asymmetrical and symmetrical weight height diminished equal amount, but in asymmetrical weight is less than length of the baby. So this is IUGR. Now coming to the prematurity. Now what are the features of prematurity? One is IUGR. Features of prematurity क्या है? So baby is small in size, usually less than 47 centimeter long. Head is relatively large. Sutures are widely dispersed and fontanelles are large. Face small, buccal pad of fat minimal. There may be abundant lanuga. Lanuga means hair in the body, lanuga, and there is little vernix caseosa. Subcutaneous fat is reduced. So these are all sign of prematurity. There are so many signs of prematurity. Testes are not descended into the scrotal sac, so empty testes may be seen. So there are so many complications of premature baby. Every complication, birth asphyxia, hypothermia, feeding difficulty, infection, ARDS, hyaline membrane disease, apnea. So all are may occur. Now, what is the protocol of feeding of preterm or premature neonate? This is important. Feeding of preterm or neonate. क्या करते हैं हम लोग? तो suppose a patient coming with age less than 28 weeks, तो हम लोग उसको इंट्रावेनस फ्लूइड शुरू करेंगे. अगर पेशेंट मोर देन 34 वीक्स का आता है बच्चा लेके, तो उसको हम ब्रेस्ट फीडिंग के लिए इनकरेज करेंगे. बट इन बिटवीन 28 to 31 हम लोग उसको नेजोगैस्ट्रिक ट्यूब फीडिंग कर सकते हैं, स्पून फीडिंग कर सकते हैं. 32 to 34 वीक्स में फीडिंग स्पून कर सकते हैं और ओरोगैस्ट्रिक ट्यूब में भी कर सकते हैं. So two important, less than 28 weeks intravenous, more than 34 weeks breastfeeding. So these are the protocol. Now coming to simple दो चार लाइन हम लोग बताते हैं. ये सब तो हम लोग हो गया. We have finished the most topic of the pediatrics cases. Okay. One is the brown adipose tissue. Brown adipose tissue is mainly found around the kidney, adrenal, between the scapula, axilla, and this spinal column. So subcutaneous fat is white. In infant, brown adipose tissue contains protein called thermogenin, which release heat. So brown adipose tissue in infant is a protein called thermogenin, which release heat. So important is it is the heat generating tissue, brown adipose tissue. Now what is encopresin? Encopresis. Encopresis is a term. Enco, ENCOPRESIS. Encopresis. It refers to the passage of fecal matter in a patient after the chronological age of 4 years. मतलब बच्चा जैसे 4 साल का हो जाएगा लेकिन वो पैखाना करते रहेगा, तो इसे इन्होंने इनकोप्रेसिस. ठीक है, तो इनकोप्रेसिस. So we have finished, complete something. Huh?
Okay.
Okay. One chapter is that